I grew up in a small city in Poland where talking about reproductive health issues were a taboo. For young people, we are not necessarily planning families now, but we would like to be able to plan our future and be able to fulfill our full potential. Unmet need for contraception, especially among adolescent and young people, leads to unintended pregnancies, unsafe abortions, and maternal deaths. Lack of resources and lack of education make young people vulnerable. We are being discriminated in healthcare because of our age, skin, our sexuality, sexual orientation, gender identity, or sexual and reproductive health choices. I don't want my children, if I decide to have them, to feel stigmatized while they're seeking the healthcare they want, they need, and they deserve.
The 2030 Agenda for Sustainable Development is grounded in respect for human rights and the power of people to change the world. Every individual on the planet has the right to health and well-being in all aspects of their sexuality, their body, and their reproductive choices. Ensuring these rights is integral to addressing poverty, education, violence against women, and gender equality. Sexual and reproductive health rights are agreed in international law. They were fought for by courageous women's rights activists and advocates across a broad range of professional fields and frontline experiences by movements of all ages, levels, and backgrounds. They are still being fought for. While progress has been made globally, many barriers remain, especially for those most marginalized, excluded, or discriminated against. Human rights are central to delivering the 17 Sustainable Development Goals in the Sustainable Development Agenda. Indeed, each SDG target is simultaneously a metric and a claim for human rights. The interplay between these political commitments and human rights obligations is particularly important when it comes to achieving sexual and reproductive health rights. For decades, human rights-based tactics have been used to drive progress. In this episode of Right to a Better World, experts share challenges they have faced and tactics they have used to address them. The challenges they describe occur in settings all around the world. The strategies used are ones that they have found to be successful in their own settings. Viewers are encouraged to learn from these experiences and consider how tactics could be adapted to their own contexts. When sexual and reproductive health begins with equality, the discussions, decisions, programs, and policies which follow can build towards a future where every individual is not only born free, but lives free and equal in dignity and rights without violence or discrimination. The time to take action is now. Every year, almost half of all pregnancies around the world, 121 million, are unintended. An estimated 214 million women of reproductive age in low-resource countries would like to avoid a pregnancy, but are not able to use a modern method of contraception. 23 million adolescents have an unmet need for modern contraception and are at risk of unintended pregnancy. Meeting the unmet need for modern contraception would result in an estimated 76,000 fewer maternal deaths each year. It would also have a positive impact on adolescents and women's rights to health, education, work, and adequate standard of living, and contribute towards the overall achievement of the commitments made under the SDG agenda.
If you invest in contraception, you're able to avert unplanned pregnancies, you are able to avert incidences of maternal mortality, and women are also given a right. Studies have shown that if Kenya had invested 5.3 billion shillings in 2015, by 2020 we would have saved 23 billion, 500 million Kenya shillings.
The economic arguments in favour of contraception are strong, but they do not ensure women's autonomy. A human rights-based approach is the only one that begins with women's choices, so that progress towards SDG targets does not come at the expense of international human rights standards. This is essential because at many times in history, contraception has been used to limit choice rather than to enable it.
Contraception in South Africa has a wicked history because of population development and because under apartheid it was seen as a way of restricting the black population in a way, right? So it was seen as, let's have more white babies so that we can grow the white state, and let's sort of have fewer black babies.
We know of cases of forced contraception, and we have had testimonies from women, particularly women from indigenous communities, in which they feel at least pressured to accept not only contraception but sterilization, for example, which follows a very long history of forced sterilization in the region. This has been due in part, I think, to these goals established of offering certain numbers of contraceptives without really having a human rights perspective, which gives health professionals a perverse incentive.
Putting women's values and preferences at the centre of family planning also means ensuring choice of contraceptive method. Where options are limited, women may resort to available options that threaten their health.
In India, the dominant method of contraception that women can access within the public health system is a female sterilization, and they're not really provided with options for spacing methods. There are these mass-based camps conducted under very dubious hygienic conditions where doctors come in for an hour or two and operate on sometimes as many as 60 or 70 or even 80 women within a couple of hours, mostly without anesthesia because they come late and anesthesia is worn off by then. And then women are just asked to lie on the ground and wait until they recover and then sent home.
Advocates also face opposition from cultural and religious groups who can often exert significant influence on laws and policies.
The mayor of Manila gave instructions to all hospitals and clinics not to give even advice or information on modern contraceptives. He said that we would like to encourage the culture of life, and so when people come to you, then just tell them that if you don't want to have a child, then don't have sex, as if it were that easy.
The contraception is accessible on the basis of prescriptions from the doctors. The doctors sometimes are anti-choice, and some of them, they don't want to provide contraception, especially in public settings. So that forces women to go to private doctors, but it increases costs, the cost of the visit of the doctor and then the cost of the contraception become a huge barrier, especially for young women, students or unemployed. So access to contraception is limited.
Gender is a powerful determinant of women's access to healthcare services, autonomy, and choices related to their sexuality, including the number and spacing of their children.
I was looking at access to contraceptives in a fishing village. So I was interviewing a number of women, and this woman told me she was pregnant with a 10th child. So I said, isn't that difficult? And she says, yeah, but I can't do anything. I can't say no to my husband. And then they tell me that life is so hard, and if they had a choice, they'd do something so that it wouldn't be that difficult.
Strategic litigation can be used to advance the clarification, respect, protection, and fulfilment of rights. It is often about raising public awareness of an injustice.
We filed a suit. I was the lawyer who filed the suit against the mayor. We had clients, about 20 very poor men and women, saying that when they went to the clinics, they asked for advice and supplies, and they were told that the mayor has prohibited it. And so at that time, they had 2 or 3 children, and by the time we filed the case, they had 9. The main idea was that they did not want to have more children because they had 3 or 4 and they were struggling financially.
Systematic and disaggregated data monitoring is a crucial tool for accountability and measuring progress towards SDG targets.
All clinics and hospitals are supposed to have people to give counseling around sex education and contraception, but so then we ask specifically, not only do they have that person, but does that person have enough training to give this sort of counseling for person with the disabilities or an indigenous person that does not speak Spanish, someone that has problems with their sight. And so what we've seen is that they don't have this type of infrastructure. So in theory, there might be access, but we try to pinpoint the differences that we see in the health system and to denounce where we see that certain people cannot actually access good contraceptive services.
The collective that I was part of, we actually had done some documentation, a study of the conditions of these camps, which we published in an academic journal, and it became a matter of national importance. It was discussed in Parliament. There was a case taken up in the Supreme Court of the country, and there were actually some judgments encouraging the government to change its entire policy and budgets for these services. So this actually we thought had brought about some change, but 10 years later, we were back to where we once belonged because there were deaths of 13 women in one sterilization camp in central India, where 80 women were being surgically sterilized in about 2 hours or less.
To deliver on the SDGs, law reforms may be needed. Enshrining rights in law is one important aspect of accountability, which is a cornerstone of the human rights framework.
We have recently passed a law about 5 years ago. It's called the Responsible Parenthood and Reproductive Health Law. The main idea here is, again, autonomy, informed choice, so that women can decide on their own whether or not to have children, when to have children, and how to make that happen. Of course, many of us, including myself, went on all over the Philippines, again, lecturing on what human rights are, and that we don't need law for rights. We just use law to claim those rights. That's why it was important to have this law, so that we had something on which we can say that, you know, the state didn't do it, to hold the state accountable.
Around the world, people are increasingly applying the language of human rights to areas of sexual and reproductive health where rights are lacking. Indeed, the Sustainable Development Agenda is explicitly centered on human rights, reflecting this trend.
In Mexico, there has been a very important shift in language in the last 20 years, I would say, which follows the trend in the global arena, I think. From thinking about issues such as contraception and maternal mortality more as a population issue and not necessarily as a reproductive rights or human rights issue. And I think that shift has been very important in Mexico, and it has translated into domestic law, which now does link specifically contraception to right to information, right to health, right to education.
Community-based interventions aimed at strengthening sexual and reproductive health information and services can help to reduce the risk of unintended pregnancy, unsafe abortion, and maternal deaths.
There is a very interesting project in Poland done within medical community, especially among women's doctors. Basically, there is some kind of a network of doctors who publicize themselves openly in social media, that they are the ones where women can go for prescription contraception whenever a woman or a girl is in need.
One intervention that has also developed involves having police provide survivors that present themselves at police stations with emergency contraception to help mitigate pregnancy. Sort of meeting women where they were actually coming for services. So they were screened for eligibility and then provided emergency contraception accordingly, and then given referrals to the health facility where they could obtain comprehensive care.
We have to work with the women of the community, the men of the community. It can't be just academics, lawyers and doctors, because if the community don't see how it's going to affect them, then it's not going to work either. In the passage of the law, when it was being discussed in the houses of Congress, the women were there, fill up the gallery. When it was in the Supreme Court, they couldn't enter, not all of them, but they would rally right outside the court with their placards, with their banners, and with their purple t-shirts. And when we won, they were happy because they knew that they committed to it.
Empowering rights holders is a crucial step to enable them to claim their rights. Through active participation in decision-making, including in relation to laws, policies, and plans to implement the SDGs, rights holders can contribute to a culture of accountability for delivering on sexual and reproductive health and rights.
So I think a contraceptive policy has to put in place a normative framework, and it has to put in place a practical framework. So the normative framework would say, what are the underlying values and principles of contraception? Is contraception something we have because we want to control teenage pregnancy, because we want to restrict population development, or is it something we have as an instance of women's choice? And I think it's very much should be an instance of women's choice.
Women can and should be making their choices about when to have children and if they want to have children or not. And that entails the entire reproductive rights arena, which is information, education, access to services, and also the ability to make decisions in every aspect of her life.
Access to contraception is a core component of sexual and reproductive health and rights, and ensuring universal access is fundamentally a matter of human rights. It is also a globally agreed commitment under the SDG agenda. A human rights approach is more than theoretical. Human rights-based tactics can offer a practical route to addressing systemic challenges such as harmful practices including laws and policies, restricted choice of contraceptive method, barriers to accessing contraception, and gender-based discrimination. By bringing strategic litigation, building the evidence, reforming laws, using human rights language, community mobilizing and interventions, and empowering rights holders. Every individual can help to deliver the 2030 Agenda for Sustainable Development, ensuring each woman and adolescent's right to make decisions about their reproductive health and future.